As the 2024 U.S. presidential election approaches, it brings with it a critical issue: the potential health hazards of wireless radiation, particularly RF radiation emitted by cell phones, Wi-Fi, and 5G networks. While it may seem far-fetched to some, this election could have significant consequences for public health, especially as the science connecting RF radiation to cancer, neurological disorders, and other diseases becomes increasingly difficult to ignore. Cancer on the ballot isn't just a metaphor. The decisions made by the next administration will directly influence how the country handles wireless radiation safety, and with candidates taking starkly different positions on RF radiation research and safety guidelines, your vote might indeed affect the risk of brain cancer, yours, your children's, and future generations. Kamala Harris, corporate capture and health neglect. Kamala Harris has aligned herself with the same policies that have allowed the telecommunications industry to continue operating under outdated safety standards. Under the Biden-Harris administration, funding for the National Toxicology Program, which found clear evidence linking RF radiation to cancer, was diverted to military projects, shutting down critical cancer research. One of the biggest failures under Harris has been the refusal to update safety guidelines for RF radiation, despite overwhelming evidence of non-thermal biological effects. The Federal Communications Commission still relies on safety standards from 1996, before smartphones and Wi-Fi were part of everyday life. These guidelines focus exclusively on thermal effects, dismissing the more insidious risks of non-thermal exposure, such as DNA damage, oxidative stress, and increased blood-brain barrier permeability, all of which have been linked to cancers like gliomas, the very cancer that claimed President Joe Biden's son, Beau Biden. Yet despite personal tragedy striking so close to home, Harris's administration has turned a blind eye to the growing scientific consensus that RF radiation can contribute to cancer. The National Toxicology Program's findings, along with those from the Ramazzini Institute, which showed similar cancer risks at much lower exposure levels, have been ignored. This is a critical failure in public health policy, driven largely by corporate influence over regulatory bodies like the FCC. Public health neglect under the Biden-Harris administration. Despite the 2021 U.S. Court of Appeals ruling that the FCC had failed to properly justify maintaining outdated RF radiation exposure guidelines, the Biden-Harris administration has allowed these antiquated standards to persist. Rather than enforcing the court's mandate to reassess these guidelines in light of new scientific evidence, the administration has remained passive, effectively allowing the FCC to continue neglecting public health. What's worse, under Vice President Kamala Harris, the National Toxicology Program, which conducted one of the most comprehensive studies linking RF radiation to cancer, was allowed to run out of funding. This halted further research that could have provided even more concrete evidence that the current FCC guidelines fail to protect the public, especially vulnerable populations like children. In short, Harris has not made any effort to safeguard public health from a threat that has been clearly recognized by the courts. Her inaction has left millions, including children, exposed to potential risks from RF radiation, even as scientific and legal findings demand urgent reform. Voting for Harris in 2024 is not just a vote for corporate interests, it's a vote that could directly impact the public's health, putting millions at risk of developing brain tumors and other serious conditions. Robert F. Kennedy Jr., a champion for public health. In stark contrast to Harris, Robert F. Kennedy Jr. has been a tireless advocate for RF radiation safety. His 2021 lawsuit against the FCC resulted in a historic court ruling that the agency had failed to justify its outdated safety standards. Kennedy has long pushed for a complete overhaul of these guidelines, emphasizing the need for regulatory bodies to recognize the dangers posed by non-thermal RF radiation exposure. Kennedy's stance is firmly rooted in science. He has pointed to major studies, including the NTP's decade-long investigation, which found increased rates of brain and heart tumors in animals exposed to cell phone radiation. Kennedy has also criticized the FCC's cozy relationship with the telecommunications industry, calling for independent research and stricter oversight to protect the public from the dangers of wireless radiation. A vote for Kennedy in 2024 is a vote for updated safety guidelines and a government that prioritizes public health over corporate profits. Donald Trump, a shift in perspective. While Donald Trump's first term was marked by appointments that favored corporate interests, such as Ajit Pai, a former Verizon lawyer, as chairman of the FCC, he has since acknowledged his past mistakes. Through discussions with Kennedy, Trump has pledged to make RF radiation safety a key issue in his 2024 campaign. Trump has committed to restoring funding for the NTP's research on cancer risks associated with RF radiation and has promised to overhaul the FCC, breaking the telecommunications industry's stranglehold on regulatory policy. By admitting past failures and shifting focus toward public health, Trump represents a significant change in the way RF radiation safety could be handled under his leadership. Voting for Trump in 2024 means supporting a candidate who now recognizes the risks of RF radiation and is committed to updating safety standards to reflect current scientific evidence. Why cancer is truly on the ballot in 2024. It may seem sensationalist to say that cancer is on the ballot in 2024, but the evidence is undeniable. The NTP's findings, the Ramazzini Institute's confirmation, and epidemiological studies like the Interphone study and Dr. Leonard Hardell's work consistently show a link between RF radiation exposure and increased cancer risks. We are no longer debating if RF radiation poses a risk to human health. We are now debating how much it will be allowed to continue harming the public without intervention. Kamala Harris's administration has not only failed to address these risks, but has actively halted research that could save lives. On the other hand, both RFK Jr. and Donald Trump have pledged to reinstate this critical research, update safety standards, and end the regulatory capture that has allowed corporate interests to dominate public health policy. Your vote could save lives. This election is about more than political alignment. It's about public health. As wireless radiation continues to proliferate, the decisions made by our next leaders will have lasting consequences on our health and the health of future generations. Voting in 2024 is not just about economic or social policy. It's about whether we will stand by as outdated safety guidelines contribute to rising cancer rates, or if we will take action to protect ourselves and our children. Cancer is indeed on the ballot this year, and your vote could be the difference between a government that protects its people and one that sacrifices public health for corporate profits. Don't vote for who has made you a complacent hostage embroiled in corporate profits over public health. Be RF safe to be sure. RF Safe endorses a Trump and RFK Jr. partnership.